Hi, very good morning. I hope I'm audible. Right. So today let's have some image-based discussion. So I have a few images. So let's see how it goes, right? Yeah. Okay, just give me 1 second. Okay, right. A very good morning. Hi, Srish, Abhishek, Dhanlakshmi, Nidhi, Purvil. Hi. Good morning. So we'll start with our image-based discussion. Here is our first question. Just identify the image, right? Very simple. So identify the first image. So what is this? Is it clear? I mean, you can only see plus symbol, right? Let me just zoom in. Hi, Yukita. I hope it's clear now. Right. So identify this first image. Rubber dam marker, rubber dam template. Yes. So this is your template, rubber dam template. So we can use this for marking your different positions of your teeth. We already have this video in e-classes where we discussed about rubber dam template. We place your rubber dam sheet on top of it and mark the tooth of interest and then punch a hole accordingly, isn't it? So this is a rubber dam template. And also we have something called as rubber dam stamp. Okay, we can stamp our rubber dam sheets using that rubber dam stamp, right? So this is your rubber dam template. Yeah. Let's move on to the next one. So identify the abnormality or identify the pathology or what is abnormality you find in this radiograph. Usually you'll have an arrow pointer. So we're discussing about this particular structure. So identify this. So it's an IOPA of third quadrant where you can see heavily restored premolars as well as molars. Yes, Ankita, you say it's internal resorption. Maybe Abhishek, Dhanlakshmi. So internal resorption, usually, I mean, with the limited information we have here, you can see radiolucency, well-defined radiolucency within the tooth structure, and you can see almost it's perforating to the external surface, right? Through and through perforation. So internal resorption, most common cause or etiology, it's implicated, I mean, it can be unknown, the etiology can be unknown, or even trauma is commonly implicated as one of the factors which causes or which leads to internal resorption, right? Yes, this is a case of internal resorption because often we see questions where they're not even describing the images, they're just giving you the image and they are asking you to give you, give a best possible diagnosis or finding pertaining to that image, right? Good. So identify a third image. can see color coding also: white, yellow, red, and blue, with corresponding increase in the diameters. Hi Shivaranjani, Khalid. Hi. Sudhan Lakshmi says it's fiber post, dental posts, post or standard size. Post of standard size. Good. Yeah. I mean, yes, these come under glass fiber posts, right? Made of resin material. Fiber post. These are fiber posts. Prefabricated. So post and code system. Good. Yes. Now let's move on to the next image. Identify. Can you identify something which is abnormal associated with this pic? Some abnormality, or do you think it's fine? Abnormality associated with this pic or picture of a gentleman. Let me just zoom in. Hold on, 2 minutes. Bell's palsy? You mean to say palsy? Yes, then Lakshmi. Good observation. You can see drooping of right eyelid. Mm-hmm. Just hold on, 2 minutes, right? Yes. Oh, okay. Toffee. Toffee. Toffee, come on. Toffee. Come on, come on. I'm sorry for the interruption, right? So, in fact, we have an artificial, or we have processes here. So, I gave you a hint. So try find out, like, where do you find an artificial processes in this image? And at first instance, it's very difficult. I found this interesting, and it's related to dentistry. Of course, it's related to dentistry. Let me give you a hint. I said artificial process or maxillofacial processes. The right side, you mean this, or nose? It looks so natural that it's really impossible to identify the processes. Okay, so we can make it now. Left eye, it's an artificial processes. You can see this entire structure missing. It's been replaced. You have various other maxillofacial processes, which includes your nose, ear, eye, isn't it? Yeah, it's your left eye. Maxillofacial processes. Right. So we'll move on to the next question. So what are these structures? So identify these structures. Hi Richa, good morning. Yes, Firaz. I mean, not just a surgeon, but even a prosthodontist uh, can help in fabricating those devices, isn't it? Yes, of course, collaboration between a surgeon and prosthodontist. Subshek, you say no idea. Yeah. So these are your bite blocks, bite props or bite blocks. Bite blocks, right? Okay. Let's move on to the next one. So identify the anomaly or the pathology associated with this image. I've just zoomed in. So you can make out there is caries interdental between your centrals. There is a dark color which can be caries, and also you have some soft tissue findings, right? So identify the soft tissue finding which you have here. Yes, then Lakshmi says gingivitis. Good. Can you be more specific? Poor belly, marginal gingivitis, Firaz, juvenile gingivitis. Ankita, you say gingivitis, chronic, chronic generalized gingivitis. Hi, Bernice. Very good morning. Yes, Preeti, marginal gingivitis. Reddening of mucosa. I mean, if I give you options, it will definitely be easier for you to look at the right option. Reddening of mucosa and lip. Okay. I mean, if I ask you to tell me the finding associated with your gingiva, so what could be the finding which is associated with your gingiva? Gingival enlargement. Okay. Chronic localized gingivitis. You can see marginal gingiva, which is reddish in color. Linear gingival erythema. It's a non-plaque induced gingivitis, which is also finding in your HIV patients, oral findings. Linear gingival erythema, isn't it? It's a non-plaque induced gingivitis. LGE, linear gingival erythema. Got it? Right. So let's move on to the next one. So identify, exactly, Preeti, permanent HIV. Identify the appliance or the component of an appliance here. I mean, they'll just simply project an arrow, identify, that's it. Toffee. Adam's clasp, good. Retaining your removable appliances, isn't it? Everyone might have done these Adam's clasp in our region. Given by Phillips, good. Phillips Adam. Right, so this is Adam's clasp. Now, what does this symbol represent? So what does this symbol represent? hazard. Firas says hazard. Preeti, biohazard. Radiographic hazard, cytotoxic hazard, radiation hazard. Radiation hazard, you'll have this a black and yellow combination, but it'll be a bit different. Good. Biohazard, biological hazard or biohazard, where materials which are deemed to be hazardous or poisonous to humans, to living organisms, they are categorized as biohazard materials, and this is the symbol for biohazard. Yeah, biological hazard or a biohazard. So identify the instrument. Let me just zoom in. So identify this instrument. So Dhanlakshmi, you seem to be very active. What time do you wake up every day? Is it 5? Good, Preeti. I remember, Preeti, you were surprised when I said 5 a.m. tomorrow. Yesterday, when in our discussion, when I said 5 a.m., I think you're a bit surprised, right? But you made it at 5. Good, Dhanlakshmi. Keep it up. 5 to 8 a.m. is the best time where you can focus more. You'll have peak concentration levels. Keep it up. Yes, Berners, it's a faucet. Okay. Preeti says bracket holder. Abhishek, Nidhi. Bracket holder. Okay. Good. Have you been to an orthodontist, Purval, anytime? Or have you seen any orthodontist working? This is an orthodontic bracket holder. Good. Orthodontic bracket holder. So identify this device. I assume we have this image even in our test series also. So what is this image all about? Identify this device. Good, Preeti. Glad to hear that. Keep it up. Scully, Salim, you say it's amalgamator. Nidhi, amalgamator. Capsule shaker. It's a very good name, Firas. So you place a JSC capsule here, you shake it, so you call it as capsule shaker. Preeti, Shivaranjani, it's amalgamator. Good. This is amalgamator. Amalgamator, something which is useful for mixing, isn't it? You might have used it. Private setup, we have these amalgamators where you place a capsule. This is a capsule holder. You'll have provision for setting the time, start and stop button, and you'll close this lid. And before placing the capsule, press the button so that the membrane, which is separating the two components in the capsule, breaks, isn't it? So this is an amalgamator. Good. Finally, we'll conclude with this. So what is this? Identify this place or identify this structure. No idea, then okay, fine. You need not really worry because you'll not get such questions in your entrance. Good, sure, engineer. Impressive. Yes, Gina. You want options? Okay, let me give you options. Sea, sky, stone, and a boat. Nidhi says body painting. Okay. Sabshek, I know you're smart. So, Gina, you said mermaid. What does mermaid mean? Yes, Firaz. Jalpari. Good. We even have some movies based on it. So, mermaid is nothing but it's a structure where you will have the top portion of the top body, similar to that of a female, and the bottom portion, it's like fish, fins or tail of fish. That's a mermaid. Uh, so, this is Little Mermaid, Denmark. Okay. We'll just have a summary of all the images which I projected and then we'll conclude, right? So we'll start with our first one again. The Shiva Engineer wanted to be a mermaid. But these are imaginary things, right? We don't really have the bronze statue. Okay. True. So first we have projected the image of your rubber dam template. As you can see, this is a rubber dam template. The top one for maxilla and bottom for mandible. And if you observe, the diameter or the circumference of maxillary arch will be wider than your mandibular arch. In few templates, you'll also have provision for deciduous teeth. I mean, these are for your permanent teeth. For deciduous teeth corresponding, we'll have a smaller circumference markings, right? You might have seen in your department, right? So this is a rubber dam template. And what is the distance? It was asked previously also, right? Even we discussed in classes. What is the distance between these two consecutive holes or markings? Yes, Abhishek. I'll share the PDF or a PPT in your group. Definitely. Good, Preeti. It's 6.3 mm or should be equivalent to the distance between two teeth in the central aspect, which is measured at the level of gingiva. 6.3 mm as per your previous questions. We have the option 6.1, 2, 3 and 4. It's 6.3, right? So we have also shown you like this is your second image where you can see clearly we have these restorations. So we have this characteristic radiolucency, internal resorption. Now, the third one, so these are your fiber pores, glass fiber pores, post and core systems. We have color coding, white, yellow, red, as well as blue. And I asked you to find out the anomaly. So we have this left eye processes or maxillofacial processes. We can make out. And these are your bite blocks, persist mouth opening, isn't it? When you're attempting treatment on posterior teeth, lots of patient finds it challenging to keep opening the mouth for a longer duration. We can take help of these mouth props, bite blocks or mouth props. And this is a case of linear gingival erythema, a non-plaque induced gingivitis. So marginal gingivitis, as you all rightly mentioned. Adam's clasp for retaining various removable appliances, for example, Hollis. Adam's clasp. And this symbol denotes biohazard materials. Biohazard. Radiation protection, that's a different logo or image altogether. I'll show you the image. Give me 2 minutes. And this is your bracket holder. Orthodontic bracket holder. I'll just zoom in so that you can see the detail. Right? So as I said, this is for your biohazard material. I'm not sure how much clear it is, but let me just show you this image. Can you make out? This is for your, radiation safety, radiation protection. This is different, right? Yeah, radiation hazard. Good. Next, radiation warning. This is your bracket holder. Amalgamator, right? Amalgamator. Finally, the Little Mermaid, Denmark. So we'll stop it here. We'll have more and more images in our test series as well as in our discussions, right? So very simple. We'll just stop it here and we'll see you again evening with a textbook discussion. So you have any questions, drop them at proudtobedentist@gmail.com, right? So it's wonderful to see you all early in the morning. So keep the momentum going and give your best, right? Yeah, you can remember that as fan shaped. You can remember that as fan shaped. Yes? Okay. Toffee. Say good morning and wish them a great day ahead. Okay, bye. Bye everyone. Have a great day. See you again today evening at 8 p.m. approximately. Right? Bye. Love you all. Yes, Preeti. The countdown, if it is not, if it really motivates you, go ahead. But if it brings out some stress, leave out and don't really go into that counting. Right? Yes. Thank you, Abhishek, for your love. Hi, Regina. Yeah. Okay, bye. Have a nice day.